causes coughing? There are a number of causes of coughs. They are mainly categorized into two, that is acute and chronic coughs. If you are experiencing cough for less than 3 weeks, then that is acute cough. Chronic coughs are the ones that present for more than 3 weeks. In most cases, chronic coughs appear to be more serious than acute coughs, which disappear even without going for treatments. However, not all acute coughs can disappear without treating them, only the minor ones like environmental allergies. Acute coughs are divided into infectious and non-infectious causes. Aside from that, the other category of coughs, that is, chronic cough, can be categorized into environmental irritants and the conditions which are within the lungs. The following are causes of coughs, both acute and chronic. Any environmental substance that irritates the air passages or the lungs is capable of producing a chronic cough with a continued exposure. Cigarette smoke is the most common cause of chronic cough. Other cough-producing irritants include dusts, pollens, pet dander, particulate matter, industrial chemicals and pollution, cigar and pipe smoke, and low environmental humidity. In addition to diseases, processes with the lung and air passages, diseases elsewhere within the chest cavity may also be responsible for chronic cough. Conditions within the chest known to cause chronic cough include cancer, unusual growth of lymph node, and abnormal enlargement of the aorta, the main blood vessel leaving the heart. Within the lungs, both common and uncommon conditions cause chronic cough. Common causes include asthma, emphysema, and chronic bronchitis. Less common causes of lung-induced chronic cough include cancer, sarcoidosis, diseases of lung tissue, and congestive heart failure with chronic fluid buildup in the lungs. The passages that connect the lungs to the external environment are known as upper respiratory tract. Chronic sinus infections, chronic postnasal drip, diseases of the external ear, infections of the throat, and use of an inhibitor medication for high blood pressure have all been implicated in chronic cough. An often overlooked cause of the chronic cough is gastroesophageal reflux, or GERD. GERD occurs when acid from the stomach travels up the esophagus. This abnormal condition can cause irritation of the esophagus and larynx, resulting in the reflux production of a cough. So those are the most common causes of coughs, both acute and chronic. I hope you enjoyed this video. This is Jeff with HomeRemedies.com. Please, if you haven't signed up to our YouTube channel, please subscribe. There's plenty of videos more to come. And also take a look at our website, home-remedies.com. I'm sure you'll enjoy all the information there. You can find home remedies on all sorts of illnesses and ailments. So thank you for listening.